Hi guys, it's Brad Thornton here and welcome to Ivory Dental Practice. Due to a few conversations I've had recently, I'm going to be talking to you about wisdom tooth problems today. Now, not everybody has wisdom teeth, and if you've got them, you don't have to worry because not everybody gets problems with them. You tend to get uppers and lowers, but more often than not, if you're going to have a problematic wisdom tooth, it will usually be coming from a lower wisdom tooth. If you have flare-ups, you probably have them every now and then. You'll get a little bit of discomfort, you'll get a bit of a flare-up, and the vast majority of cases will settle down, resolve on their own without any dentist intervention, provided you know what to do at the right time, how to manage things at home. So I'll go through a few things that will help you with that as well. Now, the reason that lower wisdom teeth can give us issues is because as they're growing through the gum, one, they tend to grow quite slowly. But another thing is sometimes there isn't enough room for them to fully grow through the gum, which can leave them in a situation where you have your wisdom tooth partially covered by a flap of gum at the back. It is this flap of gum where problems tend to arise. Because you've got a flap sat over the top of the tooth and this sort of flap of gum in this position, you have an access point for plaque and bacteria to get beneath that gum line. And it is that, because it's very difficult to clean, that can cause some gum inflammation, and this flap of gum can then start to become a little bit swollen and become a little bit tender. Often what you'll start to notice is that tenderness originating from the gum around the back of the tooth, the back of that back tooth, the wisdom tooth, and it can sometimes get a little bit uncomfortable. It can be a little bit of a nagging pain in the background. If that gum gets swollen, it can interfere with the bite, so you can find that you catch it when you put your teeth together. It might actually even prevent you from putting your teeth together fully in a sort of comfortable position because it's just in the way. If you eat on that side and you get food between the top and lower teeth and bite down and crack on that piece of gum, it really can be painful. Now, because I suffer from periodic flare-ups of wisdom teeth, I know how that feels, and my word, it does feel painful sometimes. So that kind of symptomatic, or those kind of symptoms tend to start off very low grade. Now, in terms of management of wisdom tooth problems, it's as soon as you can tell that something's starting, you need to be really proactive at trying to get on top of things so we don't allow things to progress and get worse and lead to infection. Now, the way that we do that is by making sure you keep the area as clean as possible. Now, the easiest thing to do is just brush it very, very well. Even if the gum is sore and the gum is tender, what we're wanting to do is clean under the gum as best as we can and around the wisdom tooth to remove any plaque, maybe any food debris, anything that's causing inflammation, to allow the body to kind of settle things down and get on top of the problem around that wisdom tooth. So brush it really, really well, as meticulous as you can. As soon as you notice symptoms, try to be very proactive, very meticulous, and really try and get on top of things as soon as possible. Something else that can help is warm salt water. So we would always be advising to start using warm salt water as soon as you can as well. The consistency I advise is a teacup of warm water, kind of as warm as you can get it. A teaspoon of salt, that's the right sort of consistency. It tastes awful, it tastes foul. But if you hold it in the area, maybe swish it a little bit, that can really help reduce sort of potential infection, keep the area clean. And again, all we're wanting to try and do is give your body that sort of helping hand to allow the body to settle things down on its own. Some people will advise using something like Corsidol, like a mouthwash. Corsidol's got something in it which helps reduce gum inflammation, but if you don't have that to hand, because it can be quite expensive, salt water in this scenario works perfectly fine. Do it a few times a day after you've eaten, and hopefully after a few days you'll start to notice things becoming more comfortable. For me personally, a few days, maybe a week of discomfort, but then things start to settle themselves down just by brushing it well and using warm salt water. I don't tend to need to, but if you need to use any analgesics, pain relief, use those as well. That'll sort of help maybe settle down any inflammation, settle down any sort of discomfort for the time being as your body tries to get on top of things. Now, what's important is that we're not letting things get worse, and there are a few things to watch out for, at which point you really need to be speaking to a dentist ideally, because that might be a sign that things are becoming infected. So a few things to watch out for are reduced mouth opening, which is restricting you being able to eat. That can sometimes happen a little bit, but if you feel like things are getting worse, you need to be trying to get in touch with a dentist. If it's affecting, so if you've got swelling that is affecting things like the swallowing, or you feel like the swelling is getting worse or spreading and affecting the swallowing mechanism or affecting things down here, again, you really need to be getting in touch with a dentist so that we can discuss the potential need for antibiotics, because we don't want infections around the wisdom teeth to spread. So the main thing, and like I said, 9 out of 10 times, things will settle down on their own with good brushing, analgesics, pain relief if you need them. I tend not to, because the brushing and the warm salt water tend to work really, really well. So those are the main things. Home care, give us a ring if you feel that the swelling's not improving after a few days or a week, if the mouth opening is quite restricted, or if you feel that anything's affecting the swallowing, or you can feel things in the throat, because that might be a sign that you're actually needing some antibiotics, so we can hopefully try and arrange that for you. I hope that's been helpful. Like I said, in all these situations, under normal circumstances, dentists need to really have a look to be able to diagnose properly. But considering what we're all going through, sometimes it's important just to make sure that we do everything we can at home, try as best to settle things down with good home care, and sort of get in touch with the dentist if you think things aren't really sort of working out or improving on their own. I will put some more videos up based on the questions that come through. Patients of ours, give the practice a ring, leave a voicemail, and I'll get back to you if we need to have a chat. Again, WhatsApp or social media messages are really good as well. So we communicate as much as we can, offer support as best as we can. And if there is anything that you want to discuss or you'd like a video about, then let me know. I hope to see you guys soon.